Are we being patient-centric enough in digital health?
Good morning. And can I just say a warm welcome and a thank you. And actually, I'm proud of you that you made it here this early. It means a lot to me personally. I want to thank each one of you in turn. We have a very interesting discussion. And it's interesting because all day yesterday, in almost every single seminar, people spoke about patient centricity. They mentioned it in almost every panel, but no one gave any detail. There were no answers on how we were going to achieve it. And that, to me, means that there's an opportunity to discuss. And that's what I'd like to do. And if possible, I'd like to involve you in the conversation as well. So if you've got the time and the inclination and you're awake enough, I'd love to see your hands come up during the conversation. I've got a wonderful panel. We've had lots of conversations. We had to stop the conversations, so we didn't come up with all the good stuff beforehand. That's how good the conversations have been. I'm going to ask the panel to answer a question. The question is, are we patient-centric enough? And if not, why not? So each participant will introduce themselves and answer that question, starting with Remko.
Thank you very much for showing up so early, as Hassan said. My name is Remko Schats. I'm a medical doctor, PhD, and I'm global health specialist. And 1 year ago, I founded Snigma Global Health because I thought healthcare could be better, way better, and with the input of healthcare professionals themselves, like me as a doctor. I've been working in various settings in medical care, like from academic hospitals to the refugee camps in Chad in Africa, working with Doctors Without Borders. And currently I'm working as a general practitioner with expats, businessmen, and travelers. And I see that these travelers and businessmen come to my consultation and they don't have even their own electronic health record with them. So the question is, like, are we really patient-centric enough? Are we thinking enough about the patient? So that's why I set up Snigma Global Health, where the patient is the owner or the custodian of their own health record. And I want to start also with digitalization of the WHO yellow vaccine booklet. So coming back to the question of Hassan, are we patient-centric enough? Maybe let's put the question back to the audience. Do you have your health records with you while you're here in Valletta, here in Malta? Are you able to share your health records to other healthcare professionals? If you get sick here in Valletta, can you share your health files with another doctor? And above all, can you benefit from the medical data you are making yourself as a patient? Can you benefit from that? So I see the landscape slowly evolving, and doctors also getting more and more involved. They are rapidly changing from asking the patients what is the matter with you to asking what matters to you. That's a totally different approach. So the solution, I think, to get more patient-centric healthcare is to engage and encourage patients to be more active in their own health by giving them a lifelong electronic health record and let them engage in their own health much more. So that would be my solution, to make the healthcare more integrative and more cooperative between doctors and patients. So that's my solution. Thank you.
Thank you, Remko. Marja.
Thank you. My name is Marja Huiskamp. I'm the Chief Communication Officer at Barcelona Health Hub. Barcelona Health Hub is a non-profit organization that aims to advance innovation in digital health. We connect more than 500 organizations and companies that work in that field of digital health. And that are, for example, the startups, the scale-ups, the motor of innovation, but also hospitals, universities, investors, big pharma, insurance. Basically everybody who works in digital health, we try to connect under the umbrella of Barcelona Health Hub. So my view is a little bit different from yours in that sense, because I see more the power of the ecosystem, or in this case, the lack of the power of the ecosystem. So what I see is there's a lot of goodwill. We have a lot of companies that are humanizing healthcare, that putting the patient in the center of their focus. We see that, so it's not all bad. I mean, it's not terrible, but it's simply not enough. We can do so much more as long as we work together. And there is a lot of ground to cover still. So basically, that's the view.
Okay, so far we've had 2 no's. You don't own your record, can't transfer them, can't use them when you need. The ecosystem is powerful, but not powerful enough in this case. So that's 2 no's so far. Okay, Patricia.
Hello, I'm Patricia. I'm a patient. Then I'm a migraine sufferer. I start with a blog called Mamma tiene migraña. Mommy has migraine in English. And after, I don't know, 5-6 years working in this, I run my foundation that it's called Visible Foundation with 2 clear objectives: to make visible invisible diseases and also to make visible the patients in the healthcare system, because we are invisible. Then this is the answer I give you. No, we are not enough patient-centric. Everyone is saying we are patient-centered, but we are not really working with patients. We don't co-create with patients. We don't start to work with patients from the beginning till the end. Then we are not enough patient-centric. Then today I'm here to change a little bit this thing and try that everyone start to work with patients at the same level. Then.
Okay, so patients are invisible. We need to make them visible, and we also need to co-produce, co-create with them from end to end.
Yeah.
Okay, super. So 3 no's. Okay, Kaisa.
Hi everyone, my name is Kaisa Kauppinen. I'm a design lead in Tietoevry. Therefore, I look after design activities in our social welfare and healthcare offering. And are we being patient-centric enough? We are not. And to me, I think the patient-centricity is really an enabler for patient experience. And speaking about patient experience, we talk about all touch points the patient has with the care organization and the personnel and so forth. So having patient centricity in all the touch points is something we should really pay attention to.
Okay. So surprise that we have 4 no's. I'm going to ask the audience now, is there anyone who believes we are being patient-centric enough in digital health? I'm looking for some hands, and I can see none in the massive crowd that we have with us this morning.
That's a good start, because everyone thinks the same.
Maybe we can ask the audience what they would like to see in patient-centric care. What would you like to see that we as doctors or as ecosystem or as influencers?
So we have a hand up. Would you like a mic?
Thanks, Hassan. So we talk about user-centered design, and of course that's something that we should all be aspiring to. We don't all do it. But actually I'd like to take us a step further and think about excluded communities, and it's that they're sometimes called voices that are seldom heard. They can be heard, we just don't go out and find them. So looking at minoritized peoples, because actually if we get things right for that cohort, we are likely to get it right for everybody else. And that's a group that's often excluded from these conversations.
It's called inclusive design, I would say, yeah.
So I'm going to put it to the audience again in a second, but for the panel, what should we do to find those people who are invisible? We agree that they are, but how do we reach out to them? Patricia?
Then for me, we have to work with the patients, the caregivers, the related family, okay, everyone who is involved. And then if we put them in the table at the same level, and with this, I want to add one thing that we always forgot. When we start to co-create with patients, to co-design, whatever you want, everyone in the table is paid for this job, except the patients. And this is impossible. If you want to involve the patients from the beginning, and you want, let me say, professional patients, then professionals not because they are only doing this kind of job. It's professional because it's someone who is preparing the meetings, who is preparing to discuss. everything, then you have to pay this time. And this is, I think, the most important thing, because if not, you are going to have people with a lot of free time, and it's not going to be represent all the people in the communities, or probably the people that have a job and cannot go away and start to work in a project for 1 hour, because they have to be involved in the job. Then for me it's a clear thing.
Thank you, and thank you for
Hassan,
the question.
if I can add?
Yes, please.
The thing is, what we do at Barcelona Health Hub, we have a big ecosystem, as I mentioned before. What we try to do is to include also patients' advocacy groups. I know maybe that's not enough, but at least it's part of the patient's voice that we try to take into account as well. It's not only the big companies, it's not only big pharma or startups, but it's also the NGOs, it's also the patients' groups.
Thank you. And Aisha from the Shuri Network, thank you for your question. We have a question here. If you'd like to introduce yourself.
Good morning, everybody. I'm Vijay Lutheran, founder and director of Snigma Global, Challenger Consultancy in Health and Life Sciences.
Can you speak a little bit louder, because you're difficult to understand?
Is that better?
Yep. Yeah, that's better.
So I think we're asking the wrong question. I think the question we should be asking is not whether we're patient-centric enough, but are we human-centric enough? And when I say human-centric enough, I think health it's about human-to-human contact, by and large. We have technology which is changing how we deliver health in some respects, but fundamentally it's still a human-to-human activity. And I think health needs to be central for clinicians, for patients, for carers, for administrators even. And so I think in asking the questions, you see different versions of this question. Another version of this question might be, are we clinician-centric enough in digital health? And I think by drawing lines between different groups of humans, we're asking the wrong question.
Kaisa.
I couldn't agree more. And to think about patient, I go back to the patient experience as such. So it's not only the solutions we provide for patients that we should pay attention to, but especially the clinicians. The solutions that we do for clinicians, we should try and minimize the time the clinicians, the doctors and nurses need to face the screens, and thereby they could maximize the time facing the patient. So exactly, the human should be in the center. We tend to fall in love with technology and features and all the gadgets. And why are we doing them for? Humans, right? So that I fully agree. I couldn't agree more. Human centricity, yeah.
Yes, that's absolutely true. Like, as I'm a doctor myself, I do also digital consultations, but the most intimate moment with the patient is always live. It's always live with the patient. It goes the most quick, the most effective, the most, human, as I would say. Digital consultations are good, they're nice, but the physical meeting with the patient is always better. That's my experience.
Patricia?
Then I think if we want to be more humanizing the healthcare, we need to work in round tables. And when I said a round table, that it's everyone at the same level. And this is mean for the patients, for the clinicians, for everyone who is involved in this future healthcare that we want to have. And also in MedTech, because I saw a lot of technology that it's deployed and they have never asked to a doctor or to a patient what they want, what they need, or what they think about this new technology. And sometimes this is the thing that it's going to be the change or the game changer. Yeah, exactly. Then I think it's key to have a round table and everyone at the same level and work together. The group, it's gonna be the game changer here.
Okay, amazing. We have another question from the audience, if you wouldn't mind introducing yourself.
Jarek Krivitsky, psychiatrist from Australia. I'm sorry for being a bit provocative here, but medicine develops certain cliches and language and it tries to navigate through big politics and fragmented, siloed system, which is big business as well. And I think the only time we're going to see that patient-centric being fully executed is really when patients own the data. Because
sorry, patients on the
own the data.
On the data, yes, absolutely.
So I think without that, really, it's going to be just a cliche, patient-centric.
I fully agree. If you put patients at the custodian of their own health records and give the patients the right to share their medical files with whomever, whenever they wish, then this will be a real game changer, because this puts the patients in the real power. And yeah, I think that will be part of the solution.
Yeah, but data without education, it's nothing. Because if the patient are not educated to understand this data or to understand what they can do with this data, it's nothing. Then you need to educate patients to be part of the solutions. And then I think it's clear, data, it's key, but you have to educate to change this one.
So I think there's a comeback.
Yeah.
Well, I think we're talking about medicine in the next 5-10 years. I mean, we have Generation Z coming up, and they own the data already. They're very familiar with the process, much more than probably people like me, baby boomer, and instead of trying to catch up with what's happening. So I think in some way the planning which we're discussing now is really, it's a future planning, it's not immediate. So the process of learning what to do with the data, it actually also needs to apply to institutions, how they're going to work around it when they actually lose that power base of holding the databases.
I think the meaningfulness is also important, so that whatever we offer for the patients, it's meaningful for them. Not only we pay for them to attend our co-creation seminars and so forth, but the data and the applications and solutions need to be meaningful and valuable for the patients.
But I think if we are looking to the transformation of healthcare and to make it more scalable, to let it be more inclusive, being data-driven and being patient-centric are not mutually exclusive. I think that due to data-driven, a data-driven approach can actually enhance patient-centric healthcare. It can really work to be more efficient, to be more reliable, to be more, what you said before, Patricia, to actually have solutions that work, that are needed, and not only because you have a great idea or a great solution. No, it's actually based on data that it's actually going to work.
Exactly. I think it's clear. No.
And I think there will be at least 3 things for the shortcoming future that will go. Like, the patients will be the point of care in the shortcoming future, healthcare will become globalized. So maybe, for example, doctors from America will maybe treat patients in the Netherlands, and maybe Dutch doctors will treat maybe patients somewhere else. I don't know what. And a remote will be the norm. So because the shortage of doctors is really huge, and it will be only a bigger problem.
So
speaking from my own experience.
We have another question here. If you'd like to introduce yourself.
Good morning, everyone. My name is Keith Grimes. I'm a GP from the UK and founder of a digital health consultancy. I liked what I heard earlier on about human centricity, because you're right, it often gets couched as sort of healthcare professional or doctor and patient. But the one thing that, in my experience of working in this space, is that, and I'd be interested to hear your thoughts on this, is are we being carer or third-party centric enough? Because in my experience, the people that have the highest healthcare needs are children, the sick and debilitated elderly, and those with really profound conditions. And all of those circumstances, they require substantial input of third parties, parents, elder children, other carers as well. Maybe it's part of patient centricity, but I'd want to make sure that within the humanity that we consider, we also focus on the carers and those that provide the care, because a lot of the solutions that I see spend a great deal of time trying to engage the patient, but having been a mental health patient myself and knowing when I was most unwell, and I'm an arch technologist, I couldn't even pick up a phone. I want to know that the carers, the people that will care for me, have equal access to this as well. So it's maybe just extending it slightly. But I don't know about your thoughts on that.
Well, maybe it comes back to what we said before. I mean, it's not only about including the patients, it's about humanizing healthcare. And if that means including third parties in this case, as well, of course. We see that in the Barcelona health ecosystem as well. We have a lot of startups that are focused on solutions that are actually guided towards caretakers and not necessarily the patients. It exists, it's there. And we need those data-driven approaches to actually know where the pain points are and how can we use that and use the power of the ecosystem to make sure that all those great solutions are actually getting to caretakers, to patients, to physicians. But we need it all. So yes, it's a very valid point, of course.
I think we also need to realize that more technology will also not always benefit the patients and the doctors. There's a lot of technology that is even more time consuming for both the patient and the doctor and more confusing. So we need like adequate and practical and easy to access technology in healthcare.
And I think we have to add a reminder that technology, it's only a way. It's not the end. Then the end, it's to improve the patient's quality of life, the patient experience, and also the clinician experience, the clinician's quality of life. And technology, it's only a way. It's not the end.
Okay, we're running out of time. I'm going to try and take the briefest question I can. Final question here.
I'd like to emphasize the necessity of transferability of the data. I'd like to emphasize the need for transferability of patients' data. I've worked in London and all over the south of England, and I came back to Malta. Malta has the unique situation where everything is centralized to one point. But when you get a patient, you're in a clinic in London, and you get a patient from Manchester, or a patient from Scotland, or even now in Malta, a patient from Brazil, a patient from Germany. And they don't bring their notes with them. So you've got no idea so transferability of data is very, very important.
That's absolutely right, yeah. And now often we see that even, for example, in hospitals, if you visit a hospital, maybe your data is sold maybe to a third-party software company. You even don't know that your medical data has been transferred to other third-party companies. You don't know. It happens all the time as we speak. So your data is not safe at this moment.
Thank you. We are rapidly running out of time. So I'm going to ask my panelists to think of a single statement, takeaway, that summarizes your position for the audience. But before I do, I've got an announcement. At 11:25 this morning, Aileen will be moderating a session on Femtech. And if you are interested and if you want to be an ally, if you want to be a champion, please be here for 11:25. So, Kaisa, if you wouldn't mind leading us out and then all the way down towards me.
To be more patient-centric, so be inclusive and put the humans in the center, be empathic, know your patients, and make your solutions meaningful for them.
Okay, then two things. We need to advocate for policy changes. Then this is going to be the real change. And a conclusion is never forget to include a patient in all the discussions you will have for the future healthcare.
Thank you. I would say nobody can do this alone. So let's use the power of the ecosystem. Let's use everybody to achieve a more patient-centric approach in healthcare.
Your medical files, your health, your data, and together we can do this to make healthcare more patient-centric.
And we say sorry, Gertrude wasn't able to make it, but wasn't this a wonderful panel? Can I get a round of applause?
Thank you, our lovely moderator, Hassan.
Yeah, thank you.
You did a good job.